Good morning, everyone. Today we have Nolan in the chair.
Yeah.
How's it going, Nolan?
It's good.
Doing good?
Yeah,
All
excited.
right. So for Nolan, we're targeting 3,500 FUE grafts to reinforce his the first half of the scalp, zone 1, zone 2. So what we're going to be doing is giving him a brand new hairline, connecting it to the temple so he gets the side profile, temple angle closure, and adding density all the way as far back as the 3,500 covers. And what we've already started is started the process of prepping the donor region. So what I did is I shaved the temples and the back, and this is where we'll be removing the 3,500 grafts. Yeah, super awesome donor, and his results should look fantastic.
Excited.
All right. So Nolan, what I'm going to do next is I'm going to disinfect the scalp. Okay.
Sounds good.
So we had asked you to dye the hair, so we're going to remove some of the excess dye from the skin, and we're going to numb the donor. Okay.
Perfect.
All righty. Thank you. Nolan, a little bit chilly. Here we go. All right. I can have one more, please. Dry one. Thank you. All right, Nolan. So after this, what you're gonna feel is a quick vibration on the neck. That's to distract, okay?
Okay.
From feeling the injection so much. And if I could please have a fresh glove. Thank you. And a dry
Thank you.
gauze as well. Alright, Nolan, this is the most sensitive part for this phase, okay? You're
Okay.
gonna feel a few seconds of injections numbing on the right side, a few on the left. Dry gauze. Alright. Take a deep breath for me. Bring your chin down a bit to your chest. This is the most sensitive part. Here we go. On the count of 3, 1, 2, 3. We're almost done. 3, 2, and 1. There you go. How bad is that?
Not bad.
Alright. You could be honest.
No, it wasn't bad.
Alright. Now we're gonna do the upper portion. We're almost done. 3, 2, and 1. That's the worst part for this phase. What we did on the right, we also have to do the same on the left. Thank you.
Thank you.
Here we go. 1, 2, 3. Doing fantastic. We're almost done. 3, 2, and 1. Beautiful. The upper portion. Here we go. 1, 2, 3. Almost done. 3, 2, and 1. Good job. Good
Nice.
job. You did it.
Nice.
Fantastic. All right, Nolan. So what's going to happen next is we're going to lower the chair and we're going to start the harvesting phase. As you know, the procedure has 4 phases.
Mhm.
Harvesting, design, incisions, implantation. So we're going to start with the first phase, harvesting the grafts, and we're targeting 3,500 grafts, okay?
Sounds good.
Plus we'll be doing stem cell therapy and growth factor therapy for you in your zone 3, zone 4 as well.
Perfect.
Nope,
Do you feel any of this?
nothing.
Beautiful. We're 75% done, okay?
Sounds good.
It's been about an hour and 10 minutes and we have over 2,000 grafts. All right. Quick, quiet. All right. Any pain?
Not at all.
You don't feel this? Beautiful. Your grafts are coming out beautiful. You have very much lots of multiples.
Good.
This has 3 to 4 hairs in a single graft. Nice triple. This one has about 8. All right, Nolan, done with the worst part.
Yeah.
You having to face down. How bad was the first phase?
It wasn't bad at all.
It was bearable?
Yeah, it was pain-free. I mean, everything went really well, so.
Awesome. So right now what we've done is the harvesting. Okay, we have a little bit more than 3,500 grafts.
Great.
So it'll give us extra to future-proof going to the back.
Perfect.
Okay. And let's find out the total number of grafts Marisol.
So Nolan, you received a total number of grafts of 3,584.
Nice.
And you have 8% singles, 278, 12% doubles, 424, and 80% triples.
That's awesome. So Nolan, these are your numbers. These are some awesome above average. Okay.
Okay.
So we were aiming for 35. We ended up with 3584.
That's great.
80% of the 3,584 triples.
That's good,
But
yeah.
your triples were actually 4, 5, 6, up to 7, 8 hairs is
I
what we
saw
saw.
one with 8 hairs.
Yeah. Mm-hmm.
Nice.
And that's what's going to give you a lot of density. Then you have 12% doubles. Then you have 8% singles. So the singles aren't enough for your hairline because the hairline has to be all singles. We have to create some from the doubles because we don't have enough singles. So we would have to create about 100 extra singles from the doubles for your hairline.
Gotcha.
Because you never want to put the doubles or the triples in the front.
Yeah.
It'll look artificial. Okay.
Thank you.
So what we're going to do now is we're going to disinfect the top. Okay, we're going to Clorox it, disinfect it. We'll take a few facial measurements and we'll give you some few options with the hairline design.
Sounds good.
Sounds good?
Perfect.
All right, awesome.
Thank you so much.
You got it. All right, Nolan, we're disinfecting the scalp. And we might have a little bit of extra. Do you want us to future-proof or actually reinforce the crown a bit? I know that was bothering you as well.
Yeah, definitely.
All right.
Thank you so much.
With pleasure, of course, you got it. No. You got some hair dye on the hairline, huh?
Yeah. Sorry about that.
No worries.
I didn't know if that would matter or not.
No, you're fine. I got most of it off anyways.
Alright, cool.
Alright, if I can please have a comb. Thank you. Just slightly this way. We're gonna take a few measurements right now.
Okay.
Alright, Nolan, we're going to take a few measurements of the face and see where the ideal location for your hairline would be, okay?
Okay.
So, relax my eyebrows for me. 14 and a half, 15 centimeters. Ideally, to break down the face into equal balance, we want it to be half that number. So 7.5, 7.25 would be perfect, would be ideal. Turn slightly this way. We of course don't want to give you what you had when you were 18, as we're not going to be 18. We want it to look age appropriate and natural is the key. And it seems like you've lost more slightly on the right side than you have on the left. Alright, raise the eyebrows for me a bit, and you can relax it. Alright, let's come up with a few options. Put down a bit. I like how the left side turned out. Raise the eyebrows for me. And you can relax it. If I can have alcohol with. So before I actually complete the design, I want to show you the location, okay? If I could have, please have a mirror. Thank you. Okay.
Yeah.
I think the location is pretty safe.
Yeah.
Not too low, not too high.
Yeah, looks good.
So it's around 7.25 from the eyebrows.
Yeah, I think that looks really good.
Okay. And if you raise your eyebrows, you're gonna see where your old hairline used to be. The parts of the skin that does not wrinkle is where your old hairline was. Parts that do means you've never had hair.
That's cool.
So if I was to trace it, raise the eyebrows, very simply, I could just go like this, and I could trace where your old hairline was.
Gotcha.
You see that?
Yeah,
Alright, so now let's finalize it and give you a natural looking hairline.
sounds good.
Thank you. I actually like how the right side turned out too. And I wasn't even giving much. Take a look. Which side do you like more, Nolan?
The left side.
Left side is a little bit more aggressive.
Yeah.
It's more flatter and straighter. Right side has a slight natural curvature. So this is more of the aggressive side, more youthful. This could be the safer option as you get older.
Okay.
Which one do you prefer? Let's have some fun with it. Let's do a few options.
Yeah. Can you go like in between that?
Yeah, I can. Absolutely.
Alright.
No
I'm very
worries.
indecisive, unfortunately.
You're gonna be living with this hairline, so I want you to love it. Alright, Nolan. We came up with a few options, okay? So Some were a little bit too high, some were a little bit too low, some were a little bit too asymmetrical, and you prefer more of a similar aggressive look design. So if I could please have alcohol, thank you. So I came up with this. Tell me what you think, okay? If you like it, we'll proceed breaking down the zones. Any changes you'd like me to make, let me know.
Okay.
You never want to have an identical right
that
left
makes
hairline.
sense. Oh yeah, that looks really good.
You like it?
Yeah. I can see the right is a little bit, yeah.
Let's take a look. Relax my eyebrows. So what I could do is I could keep it this way, or I could raise one side. One side is slightly higher than the other. It gives you more of a natural look. What do you think?
I like it like this.
Do you like it?
I think it's great.
Very subtle.
Yeah.
You definitely don't want to have that perfectly flat where the right and the left are identical. Naturally, our right side and our left side somewhat asymmetrical.
Yeah.
If it's too perfect, the eyes will catch it.
Yeah, that makes sense.
Okay. Do you like it?
Yeah, I think it's great.
Let me see. Turn slightly this way. But yeah, I like it too.
Perfect.
And what I want to do is I still want to make it more irregular in front of the hairline. So we're not going to change the shape of the hairline, but what I want to do is I want to place these little softeners in front of it that breaks this look of a perfectly straight hairline.
Yeah.
Those are called softeners, and it gives an irregular look to your hairline.
Yeah, that makes sense.
Makes sense?
Perfect.
All right.
Thank you so much.
You got it.
Appreciate
We're going
it.
to break down the zones. All right.
Oh, do you mean to speak to?
Oh, no, fine. Turn this way. Okay. Amanda, you approve?
Yes. We approve.
All right. If I could please have alcohol.
It's perfect.
You see how the right side is slightly tad higher than the left? Just slightly. All right. And then let's measure the distance from here to here. 9. 8.5. So if I could have the mirror, please, Alexis. So we'll take a look at this. Remember earlier how I said seems like you have more loss on your right side than you do on the left? So if I were to bring the ruler and look at that, so you see how that's 8.5, 9 centimeters?
Yeah.
From the temple to the center, and I want you to see from the center to your temple on the left side.
It's shorter.
It's shorter, it's 8.5.
Okay.
So you have 0.5 centimeter more loss on the right, which basically means when I do the design, your right side, because it has further loss by 0.5 centimeter, the line's gonna look longer.
Okay.
Does that kind of make sense?
Yeah.
Versus the left side is gonna look shorter because your temple's more forward. Do you sleep on your right side more than the left? That could be one of the reasons sometimes.
I think I do, yeah.
Do you? Yeah, if you sleep on one side more than the other, usually there's further loss.
Gotcha.
All right, we're gonna break down the zones. Bring your chin forward. So zone 1 is the first 2 centimeters, okay? Starts at the point of the hairline, goes back 2 centimeters. Just because of your dimensions of zone 1, that's probably going to chew roughly around 2,500 grafts.
Okay.
The additional 1,000, 1,100 will place in your zone 2, which is the following 5 centimeters.
Got it.
Alrighty, and I'm going to outline the thinnest areas here. Thinnest areas here. Close your eyes for me and look up a bit. Perfect. Love it. Alright, now we're going to take a look. So, today the plan is to reinforce your zone 1, your zone 2. Zone 1 starts at the point of the hairline, goes back 2 centimeters, and we said from the center to your temple it was 9. So when I multiply 9 going this way times 2, I have a surface area that's 18. That means I have to fill 18 1 centimeter squares. Natural density in 1 centimeter square is going to be anywhere from 70 to 100 grafts. This was 8.5, goes back 2, so your dimension here is 17, so we have to fill 17 1 centimeter squares. The other area that you need restoration, reinforcement, is your zone 2. Zone 2 is the following 5 centimeters, ends right here, which blends in actually really nicely with where you have the most amount of hairs. So what I've done is I've outlined it, but I've also done a little triangular section here. You see that?
Yeah.
That means in your zone 2, this area is going to need much more attention versus what you have here in the center, because this is basically fuller than that corner.
Yep.
And what I've done is I've done the same here.
Got it.
We're going to fill all of this up. Anything extra, which we are going to have, then we're going to go in between, because this also is not at its highest density.
Right.
One day you will lose this, because as you know, hair transplant is not cure. We're not changing your genetics. Doesn't mean you're never going to have hair loss in the future. The transplanted hair should be with you for the rest of your life, well into your 60s and 70s. But this, or the back, if you don't take care of it, can still fall out.
Yeah.
So we'll future-proof it. Anything extra, then we can also place a few hundred in the crown if we get anything extra.
Perfect.
Okay.
Sounds
So I'm going to shave the rest of the hairs now that we have designed it. And we'll basically work on the next phase, which is the incisions. Okay?
Perfect.
So you're technically halfway finished today already.
Sounds good.
Hasn't been that bad, has it?
No, it's been awesome.
Okay,
You guys have been
cool.
great. Appreciate
Awesome.
it.
You got it, Nolan. Alright, Nolan, ready for the shave?
Let's do it.
Here we go. Have you had your head shaved before?
No.
No?
Not since I was like a kid. I knew it was coming one day though.
Yeah, this is where a lot of clients go, I've never had my head shaved before. I actually like it.
Too late.
Too late, the grafts are out. Now keep in mind, everything we do today, hairline's gonna rise and be swollen for 3 to 5 days, okay?
Okay.
Because we're gonna inject the scalp with numbing. So it rises. And I don't want you to think what you see immediately tonight is what it's gonna look like.
Okay.
It's gonna drop next few days.
Alright, sounds
Make
good.
sense?
Yeah.
Alright. This part, I need you to keep your head nice and steady.
Okay.
Going to outline the pencil with the marker, okay?
Okay.
Alright. If I could please
You're
have
right.
the marker and the fresh gauze, please.
Do you want me to face him more towards
No,
you?
you're good.
Okay.
Yeah. Just
Stay
no
still.
expressions of the face, just keep it nice and steady. Here we go. So now when I'm gonna place the softeners in the front to make it look jagged and irregular, okay?
Okay.
This is what's gonna give you that natural look, and all of these are gonna be all singles. And I'll show you a very slight widow's peak of what it could look like. If you don't like it, we'll get rid of it. There's no specific design to the softeners, it's just irregular, randomly placed. We don't want to have a pattern to it. And then a slight widow's peak could look like that. Alrighty. Look at me. Yeah, I love this design on you. Very slight widow's peak. You see that?
Oh yeah.
It kind of shrinks the size of the
It's-
forehead and it compacts.
Yeah.
You like it?
Yeah, it looks good.
Alright, so to recap, brand new hairline, going to come across your temple, and it's going to drop like this to your temple. This is called the temple angle closure. This is what's going to frame your face almost like a photo in a picture frame. So basically, it kind of looks like this once everything grows, okay?
Gotcha.
Same on the left side. Hairline's gonna drop in and blend into the temple. Last thing you want is a hairline that goes this way. You want it to blend in. We're gonna reinforce all of your zone 1 right side, all of your left side zone 1, Next priority, zone 2, is going to be this triangular area.
Mm-hmm.
Then this region here. Anything extra, we're going to future proof here. And then we're just going to work our way backwards. Anything extra, we'll divide it in your zone 3. Okay, future
Perfect.
proof that. You like it? You approve?
Yeah,
All right, my friend.
love it.
So you're technically halfway, like I mentioned earlier. Procedure has 4 phases: harvesting, design. We're gonna do incisions next. Incisions is where we make tiny little slits of what we took out earlier, the new homes for them. This is where we follow the client's existing natural angles and directions. If they don't have it, we would have to recreate it. And then you're gonna have lunch after this phase. Finish the day with the implantation, okay?
Perfect.
All you have is a few more seconds of injections to numb the top. If you can tolerate 2 pokes on the right eyebrow, 2 pokes on the left eyebrow, numbs about 75%, 80% of the scalp. Then you have 2-3 seconds of injections discomfort on the right and left temple. That is it for the entire day.
Perfect.
Sounds good?
Let's do it.
All right, awesome.
you.
I'll take the mirror. All right, Nolan. As I mentioned earlier, we're gonna numb the top of the scalp, and the way that's done is 2 quick pokes on the right eyebrow, 2 quick pokes on the left eyebrow. The supratrochlear and orbital nerves you have to numb, okay?
Mm-hmm.
Alrighty. This is the most sensitive part for this phase. If you could tolerate this, the rest is super duper easy.
Mm-hmm.
You're gonna feel a little vibration device on the forehead. That's to distract the nerves, okay?
Okay.
Do me a favor. Don't make any sudden movements of the head. I don't want you jumping up. I don't want the needle going close to the eye. So you're gonna feel it poke here, poke here, and here.
Okay.
Take a deep breath. Inhale, exhale. By the time you say ouch, it's done. Here we go. 1, 2, and 3. That's it. Super fast. Here comes the second one. These are tear jerkers. 1, 2, 3. Don't move. That's it. Right side's all done. Alexis is gonna give you a glass of juice. Take a sip. This is just to distract you. Distract the mind. Has nothing to do with the
Thank you.
transplant. Alright, what we did on the right, we have to do the same on the left. Here we
This is
go.
a tearjerker.
It is. But you see how quick that is?
Yeah.
Poke here, poke here. You have a little scar on the eyebrow.
Mm-hmm.
1, 2, 3. And then here comes the second one. Don't move. 1, 2, and 3. That's it. You did it. Good job, Nolan. I'm gonna go again on this right eyebrow. It should be completely pain-free. You should not feel anything. Here we
Okay.
go. Does that hurt?
No.
Good. Here we go again. Does that hurt?
No.
Good. Same on the left. You should not feel a thing.
So just the initial, huh?
Just the initial. Does that hurt?
No.
Beautiful. That's it. You did it.
Perfect.
Good job. So you're gonna have the super numb sensation on the forehead right now. Okay?
Okay.
Almost feels like you're wearing a steel helmet.
Yeah.
Super tight, super numb. In about a minute or two, majority of the scalp on top is gonna go numb, so you're not gonna feel most of the
Okay.
injections on top. You will feel about 2-3 seconds on the right, 2-3 seconds on the left. That is it for the whole day.
Awesome.
You're doing fantastic, my friend. I'll give it about a minute, and we're gonna start the next phase, okay?
Cool.
And towards the end of the incisions, Dr. George or one of our team members will come in to draw the blood for the PRP as well, and we'll do stem cells along with the PRP.
Perfect. Thank you so
All
much.
done. With pleasure, Nolan. You got it. Alright, all done. Alright, Nolan. We're gonna have to numb the top. As I mentioned earlier, most of this is gonna be pain-free, okay?
Okay.
So corners are what's gonna sting a little bit. Here we go. Feel this?
No.
Good. Now it's gonna start being sensitive here. 3, 2, and 1. That's it. You did it.
Yeah, not bad.
How bad was that?
Not bad at all.
Bearable? That's the worst part.
It's kind of cool how it gradually got.
Turn slightly to the right. Yes. Goes from completely numb to mild sensitive. Almost done. 3, 2, and 1. Sensitive corner here. You're all set.
Perfect.
That's the worst part, and you did it. You did amazing. All done.
Awesome. Thank you.
You got it. This is the part where you could close your eyes, think of happy, beautiful thoughts. Maybe a beach somewhere in Hawaii. In the numb. not be feeling any of these.
No.
Head's gonna feel super duper heavy. That's normal, okay?
Okay.
Any pain?
No.
Beautiful. All done.
Awesome.
So you should not have any discomfort for the rest of the day. That was the most painful part for this face.
Perfect.
Alright, Nolan. Flor just came in to draw some blood for the PRP and the stem cells that we'll be doing. So she doesn't have to poke you. We're gonna use the pre-existing line, okay?
Yep.
And Nolan, we're almost done. I only have about 300 or so extra incisions to make. And after this, you're gonna break for lunch, okay?
Perfect.
Beautiful. How bad has it been so far? Bearable?
Yeah, it's been unreal. I appreciate you guys.
Oh, you got it. It's a pleasure having you here today with us.
Thank you.
So, what I'm doing right now is I'm feature proofing the center area that we talked about where you had the most.
Oh yeah.
But it's still not the highest density, but compared to everything else that you had, it was the most
Right.
area that you had density. So we're feature proofing that. I don't think we're gonna have enough to do the back as originally mentioned,
Sorry.
the crown, but we'll be doing stem cells, growth factors everywhere, so that should also boost.
Yeah, sounds good.
Are you feeling any of this?
No, not at all.
Beautiful. And it'll be done in 2 minutes.
Okay, just about done now.
And then in a minute or two, we're gonna break for lunch. What'd you order for lunch?
Well, I got the filet mignon.
Oh, nice. Good
Yeah,
choice.
looking forward to it.
Yeah. Have great salads. Their filet mignon's really awesome as well. Great place. Their salmon is good too.
Yeah, I was looking at that too. Thank you for the lunch too. I really appreciate it.
Oh, you're welcome. You are a guest today. Guest of honor.
All right, Ricky, thank you so much.
Yeah, thank you.
You're welcome.
All right, Nolan. How was lunch?
It's great.
Lunch was good?
Yeah, it was awesome.
Awesome. So, you haven't seen it yet, have you? Did you take
No.
a sneak peek in the restroom
No.
when you went in?
No,
No?
I can't wait to see it.
So, keep in mind, what you see right now isn't the final results.
Okay.
Okay? Hairline's gonna drop. Right now, you might notice the one side's a little bit higher, one side could be a little bit lower. It's all the fluid, the tumescence.
Okay.
Especially for the right side, you had much more loss. So we gave you more numbing on the right side, so it could be a little bit more swollen compared to your left side, okay?
Okay.
So let's remove the gauze. Let's do a quick wipe.
I'm anxious.
We talked about the widow's peak.
Yeah.
We gave you that widow's
Wow.
peak as well.
That looks so good. Oh yeah, I see the right side like you said.
Yeah, it's a little bumpy here. You see that? This
Yep.
is all fluid. Next few days, this swelling is going to come down and your right side is going to be lower than how it looks right now.
Gotcha.
Reason why I have this is a little bit higher and it's more swollen is because you had more loss side to give you a little bit more numbing, so compared to your left side.
Okay.
But by tomorrow, all of this will even out. Hairline will be lower. Love the widow's peak, very subtle,
Wow.
very youthful looking hairline, and we covered you all the way back to the first half of the scalp.
That's
Okay.
unreal.
You like it?
Yeah, it looks so good.
Let me see. I love it.
Thank
Yeah.
you so much.
You have to wait a year and a half to see full results, but by 6 months, you'll be about 40-50% growth. You'll get
Perfect.
the outline and it just gets better and better.
This is crazy.
Happy. Team's gonna come in right now and we're gonna start the implantation, okay?
Okay.
And we're doing stem cells and PRP. let's go over the plan one more time. Would you like us to focus the growth factor stem cells in the front or the back, the crown? Or we could do half and half as well.
What would you suggest?
My preference is the front, obviously, just because you have trauma. Anytime you have trauma, because we made the incision sites, the growth factor stem cells was going to help you with healing, recovery, sooner growth, higher survival rate of the grafts. Those are the benefits.
Okay.
The back, you could keep on doing the minoxidil, topical finasteride, or you can always come back later on in the future and do PRP stem cells back there. But in my opinion, since we traumatized the front with all these 3,600 incisions, probably a better idea to focus in the front, or we could do majority in the front, some in the back as well if you want.
Okay.
Which one do you prefer?
Can we do majority in the front and then just some in the back?
Like 75, 25?
Yeah, would that be good?
Sounds like a good plan.
You think that's a good idea?
I think that's a fantastic idea.
Okay, perfect.
All right, my friend. You're not gonna feel a thing. You're gonna watch a movie or two. Next thing you know, we'll be done. Okay?
Perfect.
Few
Thank
more
you so
hours.
much.
You got it.
Appreciate it.
Alrighty, Nolan. So what we're gonna do for you now is we're gonna inject the PRP with the stem cells. Okay?
Okay.
What the PRP and the stem cells are going to do for your surgery today is going to help with the healing process. So you'll heal faster. Your transplanted hairs will grow sooner, as well as more of those follicles that we're going to transplant should survive.
Okay.
Increase the survival rate.
Yep.
And as we mentioned earlier, we're actually going to be able to focus 100% in the front and 100% in
Yeah.
the back. Well, you're getting double the stem cells today, okay? So we're not skipping any corners.
Yeah. Thank you so much.
You got it. No pain, correct?
No, I can't feel anything. I didn't even know you were going.
Perfect. Beautiful.
How's your day been so far?
It's been unreal, to be honest with you. You guys are awesome. It's just made the experience, so much better. I was anxious, nervous coming into it, but the whole staff and just everyone in general, it's been unreal. So I'm really appreciative.
Who paid you to say that?
Nobody. That's all me, from the heart.
Awesome. Well, thank you. We
Thank
appreciate
you.
that.
Yeah.
All right, Nolan, I'm going to give the distribution, the plan for the team. So, of course, we want the singles, guys, for the hairline. Looks soft and natural. Nolan has the most amount of triples we have seen, almost 3,000. 2,882 triples. Basically, all of his zone 1 and majority of his zone 2 is all going to be triples. The only area which are going to be the extra 400 doubles is going to be here in the center. Everything else is going to be threes, 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 and threes. Super thick density, threes here. Singles for the hairline going through the 4 rows. Singles for the widow's peak. And these are going to be doubles, which he had the most amount of hairs in the center anyways. So it's going to look amazing in about 6 months' time.
Yeah, can't wait.
We're not going to recognize you when you come in.
Yeah, seriously.
All right. A few more hours and you'll be done, okay?
Sounds good. Thank you so much.
Could that like be my nickname?
Yeah, I guess.
Ah, nice. I like your style. Car. That could be yours.
Yeah, Carl's pretty sure already, but
You can see it's the kind of dazzle we need around here.
Yeah.
And you know what I did?
What?
Well, that whole Demco thing really chapped my ass. I marched upstairs and I told the big guns, Carl gets promoted in lieu of Demco, or along with Demco, whichever, or I walk.
Really? What'd they say?
Well, they were quite attracted to the me walking option, for a moment. But then I threw that off the table.
Good move.
And they said if you started to show some initiative, I could promote you.
Yeah.
Well, you're doing it.
Yeah?
Yeah, the whole cake thing.
Yeah.
You're making up nicknames.
Okay.
You know what? I called Demco this morning to ask if he could work on Saturday. Do you know what he said?
No.
Oh, how'd you know that?
He's not here.
Oh, yeah, but you are, Car.
Yeah.
And that's why I'm going to give the job to you.
Norm, that's amazing. Oh my
Yeah.
God, thank you.
Nice little raise in it for you, too. Bump up your salary to 65.
1,000?
Of course, 1,000. Come on, let's step this thing up a notch, Brosen.
Oh.
See what I did there?
Mhm.
I joined Bro with Joseph. Brosen. Pretty cool, huh?
Very cool.
Alright, Nolan, congratulations, you did it.
Thank you
You
so
made
much.
it through super clean, high density, jam-packed almost all of your 3,600 grafts. Alright, so
Perfect.
what we're gonna do next is we're gonna do the post-op. And we'll meet in my office once
Okay.
you're done changing, and we'll talk about how to take care of your grafts tonight, what medications you have to take. Okay, you haven't seen it yet.
Okay.
So, get you a mirror. Keep in mind what you see right now is swollen.
Right.
Okay, let me dab. Alexis, if I could have the mirror, please. Alright, Nolan, take a look.
Wow.
You see how
Yeah. Wow, that's so cool.
those are all babies right there.
Gotcha. And you said it's swollen. Yeah, I see that. Wow, that is so cool.
It's nice and irregular.
Yeah.
What you don't want is a perfectly straight hairline.
Right.
You want it to be jagged. You have that very slight widow's peak in the front.
Mm-hmm.
Right side, left side are pretty similar without making it look 200% identical. That's the key.
Yep.
When it's too perfect, the eye catches that you've had something done. Like I mentioned, this will drop
Right.
and it's gonna look more like the left side the next few days. Look at that swelling you have. This is all fluid. You see
Yeah.
that?
Yeah.
So it's gonna look like the design we did. Right now, it's elevated,
Mm-hmm.
it's swollen. Next few days, it's gonna come down by half a centimeter or so.
Okay.
You have at least about 20 cc's, 25 cc's of fluid in the scalp. But overall, what do you think?
It's unreal. I mean, I never thought I'd have a hairline like this again, so
Right?
I'm very satisfied. Thank you so
Good.
much.
You got it.
I appreciate
Very
it.
youthful, and this is where I go. Do you like it or do you love it?
I love it.
You love
Absolutely
it?
love it, yeah. I
Awesome.
can't wait to see like the final product. Thank you so much
All
for
of
everything.
this is gonna fall out in
Yeah.
about 10 days up to 1 month, okay? 28 days. Don't freak out. It will take at least 3 to 4 months for you to see any new hair growth.
Right.
Okay? After 3 or 4 months, you're gonna get about 10% growth.
Okay.
Then it just gets better and better. By 6 months, you're about 40-50% density.
Awesome.
It's gonna take 1.5 years. Majority of your grafts were 5, 6, 7, 8 hairs.
Yeah.
Okay, plus we did 2 kits of stem cells and we did PRP for the front and the back. So
Yeah.
no reason for you not to get the most amazing outcome as long as you take care of it.
Yeah.
Don't bump your head, don't catch an infection, and follow to the T everything we're gonna talk about.
Sounds good. Thank you so much. I
Very
appreciate it.
awesome.
Thank
Good
you.
job.